Medication back orders and what you can do when this happens. If you're new here, I'm Chelsea, a rural retail pharmacist with 16 years of pharmacy experience, giving you a look at life behind the pharmacy counter. I recently had a conversation with one of my patients a few months ago when the Adderall back order was worse than it is now. She was on the hunt for Adderall and was having a hard time finding it. She did find it at a pharmacy and had her doctor send it to that pharmacy, and the doctor wrote it for 30 because she needed 30 capsules or 30 tablets for the month. But that pharmacy only had a quantity of 10 in stock. Now, what I would have done in this situation is I would have offered the patient the 10 that I had and then notified the provider that they only got 10. Instead, this pharmacy said that they had to get a new prescription for the 10 tablets or 10 capsules. Honestly, I do not think that they needed to do that. I don't know what their company policy is. In my experience, if we have a prescription for medication for 30 tablets, but we only have 10, 15, 20 of them in stock, we can always dispense less. If you run into this situation where your medication is on back order or they don't have enough of it, always ask the pharmacy if you can get a lesser quantity that they do have, especially if you're having a hard time finding the medication. With that being said, on C2 medication, so like your Adderalls, your hydrocodones, typically if you take like 10 out of 30, the rest of the prescription is void. In those situations, I reach out to the provider and just say, hey, patient only got X amount. They will need a refill sooner than normal. And then the provider just sends us a new script.